Libby Ashworth, diagnosed at 14. Libby Ashworth's journey began when she was in 6th grade, experiencing persistent illness. She frequently felt sick, lost her appetite, and suffered from back pain. Initially, these symptoms were dismissed by doctors, attributing them to common issues in teenage girls. However, by her freshman year of high school, Libby's condition worsened. She experienced severe abdominal pain, constipation, and eventually noticed blood in her stool. Despite multiple visits to different doctors, her symptoms were often overlooked or misdiagnosed. One doctor even suggested her issues were psychosomatic and referred her to a psychiatrist. Libby's parents, convinced something was seriously wrong, continued to push for more thorough testing. Finally, a new doctor agreed to perform a colonoscopy. In December 2020, at just 14 years old, Libby was diagnosed with stage 4 colon cancer. The diagnosis was a shock, but it explained the severe symptoms she had been experiencing. Libby's persistent back pain was particularly concerning. It was later understood that this pain was due to metastasis, where the cancer had spread from her colon to other parts of her body, including her spine. This spread caused compression of the nerves and spinal cord, leading to significant discomfort and pain. What are the symptoms of colon cancer? The symptoms of colon cancer can vary, but some common signs to watch for include 1. Changes in bowel habits, persistent diarrhea, constipation, or a change in the consistency of your stool. 2. Rectal bleeding, blood in your stool or rectal bleeding. 3. Abdominal discomfort, cramping, gas, or pain in your belly area. 4. Incomplete bowel movements, a feeling that your bowel doesn't empty completely. 5. Weakness or fatigue, unexplained tiredness or weakness. 6. Unintended weight loss, losing weight without trying. 7. Bloating or full feeling, persistent bloating or a feeling of fullness. A recent study has found that nearly half of individuals diagnosed with early-onset colorectal cancer experience 2 key symptoms: abdominal pain and blood in the stool. These symptoms are particularly common among those under the age of 50. Additionally, patients diagnosed before age 50 were more likely to have metastatic disease at the time of diagnosis compared to those diagnosed later. What are the risk factors for early-onset colorectal cancer? Several risk factors have been identified for early-onset colorectal cancer, which is diagnosed in individuals under the age of 50. These include 1. Genetic factors. Hereditary cancer syndromes like Lynch syndrome. Lynch syndrome, also known as hereditary non-polyposis colorectal cancer, HNPCC, is a genetic condition that significantly increases the risk of developing several types of cancer, particularly colorectal and endometrial cancer. If a family member is diagnosed with Lynch syndrome, it's recommended that family members undergo genetic counseling and testing to determine if they carry the mutation. 2. Lifestyle factors. Obesity, a sedentary lifestyle, and diets high in red and processed meats. 3. Chronic conditions. Inflammatory bowel disease, IBD, and metabolic syndrome. 4. Family history. Having a first or second-degree relative with colorectal cancer. 5. Other factors. Smoking, alcohol consumption, and an altered microbiome.